Hi, my name is Rob McBain. I'm one of the vascular medicine consultants at Mayo Clinic in Rochester. And I have with me today Mr. Kenneth Peel, who has an amazing story related to his experience with extensive blood clots in the veins. When I first met Mr. Peel in February of 2013, he had such extensive blood clots that he was really quite incapacitated. And in fact, here is a representative of the amount of clot that he had in his body. Here we have the venous system, and you can see that the blue represents the clot, where it's white represents no clot. And of course, he has extensive clot involving the large vessel in his abdomen called the vena cava, both iliac veins, and on the left you can see that he had clot almost down to his ankle. And when I first met Mr. Peel, he was extremely uncomfortable. Tell us, Mr. Peel, tell us about the extent of your symptoms back in February, if you can remember that far.
Well, the pain was intense. I had gone to the hospital in Waterloo, and they felt I should come back in 3 weeks and see if things would get better, but the pain was so bad that I could not tolerate it. And my calves and my legs were almost half the size of a volleyball, and I couldn't walk the length of our dining room table. So my wife brought me up here, and on a scale of 1 to 10, the pain, that doesn't cover it. You'd have to go 12 or above. And they told me the dangers of this procedure. I opted that I'm not suicidal, but I would rather die than live the way I was. It was that bad.
Yeah.
And now I'm great. I'll walk with anybody. I can walk all day. I can climb stairs. I have no pain in my legs whatsoever, other than being an old man. I'm 75 years old, so I have a few restrictions, but not from what happened with my legs.
So, Mr. Peel, thank you. I know this is it's emotional. It was emotional for me back then. I could see you. I remember first meeting you in the hospital, and you were sitting, lying in your hospital bed, and you were in agony, as I remember. And I remember talking to you about the procedure. And what we had, the procedure that specifically we're talking about for Mr. Peel is that he had a procedure called mechanical thrombectomy and venous thrombolysis. And what that is, it's a catheter-directed procedure. It's not major surgery. Catheter-directed procedure where we'd actually go behind the knees up into the veins of the leg and into the large vessel in the abdomen called the vena cava, and we actually, with mechanical means, bust up the blood clots, kind of like a roto-rooter, if you will, and then with chemicals and medicines, we further bust up any residual blood clots. And I remember us talking about that, and because of some other history that you had, we were both concerned about bleeding and such, but how did that procedure go for you? Do you remember actually going through the procedure?
Yes, I do. I remember laying on the table face down, laying on my stomach. And when they started the procedure, it was hardly any time at all. And I heard someone exclaim, "Oh my word, look at how far up that vein we can see." And I could feel the joy and the pride of the people that were behind me that I couldn't see, but I could feel it in the air.
Mm-hmm.
And they were just amazed at what was happening. And I was kind of glad that I lived through the procedure myself, and they had done that 3 more times. And I'm very grateful.
Tell me, did you have, so that procedure comes with a very low risk of complication. We always think about bleeding, and the risk of bleeding is somewhere in the neighborhood of 1 or 2%. And as I remember, your procedure actually went quite smoothly. And I also remember getting a phone call from the person doing your procedure, absolutely giddy at how successful they were able to be in regard to removing the blood clots. And now, so the procedure in your mind went reasonably well?
Not reasonably, it went fantastically well. And boy, when you're laying there and you can hear this doctor, the joy and the pride in his work and the staff, that's pretty comforting. And I lost all apprehension about the next time they were going to do it. I had none whatsoever. It didn't end. And afterwards, I had mild discomfort in the calves of my legs for maybe 3 to 4 weeks. but that's gone, and I got another chance at life.
That is such a great story. Let me ask you, so we were talking about before we met, you couldn't walk the length of a dining room table.
No.
So not from one end of your dining room to the other. Tell me about how far you can walk now.
I'm not sure how far I can walk, but I don't think there's a limit. If I can't run because I'm short-winded, but it was, my legs won't give out, but I could walk from here to Stewartville.
And Stewartville, for those of you who don't know, is 8 miles from Rochester. Now, tell me, you guys, you and your wife are in the process of building a brand new home. That's really exciting. In the process of moving, you mentioned something about doing some heavy lifting and carrying.
Okay, we have 16 steps from our main floor down into the basement. And my wife had things all boxed up, and I carried it from the basement and put it in the garage. I made 32 trips in less than 2 hours carrying things up, and my legs never gave out on me.
So thank you. Now the issue with regards to this problem of extensive blood clots in the legs is that we're really concerned about residual swelling in your legs. Leftover swelling that's called the post-phlebitic syndrome. Now, 3 months later, because this was in February, it's now May, 3 months later, how's the swelling in your legs?
It's really non-existent. It's fine. I don't have any swelling.
And you'll see today, folks, in Rochester, Minnesota today, it's an uncomfortable 90 degrees. And so Mr. Peel didn't wear any socks today because he wanted to stay cool. Let's see your legs there, Mr. Peel. And man, there's absolutely no swelling whatsoever and no ulcers, no changes in his skin. How about the other leg? That was the worst of the two. And just like the former, this looks absolutely perfect. There is no swelling. And he's not wearing compression stockings. So that's perfect. Listen, so thank you, Mr. Peel. Thank you for coming and sharing your story with us today. As we discussed, the intent of sharing your story was to offer hope for people out there who have suffered from extensive clots of their legs. Know that there is hope. Know that there is treatment available. Know that you can go from being in agony to being back to normal. And know that you can undergo these procedures with a minimum of risk. And so, if there's anybody out there who has such a problem, I personally would be happy to see you at Mayo Clinic Rochester. And so I just want to thank you. Thank you for sharing your story.
You're welcome, and if they have any questions, they can feel free to call me, and I will tell them my story, because I'm so grateful.
Thank you, Mr. Peel.